Welcome Year 9 to the options process for 2021. I hope you find this PowerPoint interesting, and if you have any queries or concerns, please get in touch with me. My name is Mrs. Burford. I will be talking you through the Level 1 to Level 2 BTEC Tech Award in Health and Social Care. If you have any questions that I can answer, please contact me directly on the email shown in front of you, which is burford@wyvernacademy.org. So the first thing that you might be thinking about health and social care is, what is it and what will I do? As this is not a subject that you have covered in Key Stage 3, and it is only a subject that we start to look at Key Stage 4. So let me explain a little bit more of this to you. So if you're looking to go into the health and social care sector, okay, so anything to do with health, anything to do with social care, so looking after or supporting other people, then this is a must course for you. You're going to learn about a multiple range of things. You're going to look at the 6 developmental stages of life, from infancy all the way to later adulthood, and we're going to look at the development process of that, which is looking at how people develop physically, intellectually, emotionally and socially. And then obviously we're going to have a look into that on how that can affect life events and life circumstances as well. You're also going to, in the other component, going to learn about the different jobs that's in these sectors and the categories that they come into, which I'll talk a little bit later as we move through this PowerPoint. And also within this, you get the opportunity, unlike other qualifications, where you gain hands-on experience to actually see whether this is a position that you would like to move forward with when you move to post-16, which is going on to college or apprenticeships. So it gives you a good starting base to actually get your hands on the practical element to see whether this is right for you. So obviously we have to be assessed, because you will come out with a qualification of either a level 2 pass, which is equivalent to a 4 or 5, a merit, which is equivalent to a 5.5, and then a distinction or a distinction star, which can take you up to an 8.5. So this is broken down into 3 components, and components just simply means units. So component 1 looks at in-class work. So you will be provided 2 assignments or 2 pieces of coursework which you will be given classroom time to complete. These will be provided and submitted to myself or the classroom teacher for first draft, feedback and then final grading. Component 2 is also in-class work as component 1, but this is the area where we go hopefully out of school and go into a practical situation, for example a care home or some kind of area where you will need to demonstrate the care values. And obviously you will be evaluated on that from the classroom teacher, and using that information you will then be able to create an evaluation. All of component 1 and component 2 aim to be completed by the end of year 10, which then allows you for component 3 to focus solely on your exam. Your exam takes place usually in February time, with the opportunity, if required, to then resit a second time when you have your normal GCSEs, which is around May-June time. But the idea is that this will be completed in the February, and then you would wrap everything up so you can then focus your time on your other subjects in preparation for your big chunk of exams in the June time. So what can I do with this subject qualification when I leave Wyvern Academy? So if you can see in front of you, there I have broken all the jobs down into 4 categories. Unfortunately, I'm not able to put every single job on here, but I hope to give you a little bit of a taster, and if you have any queries about whether the job that you have in mind fits into these categories, then you can get in touch with me. So the first category is a primary healthcare provider. So these are the people that we go and see first and initially. So you might go and see your GP, you might go and see your dentist, you might go and see your optometrist, which is your eye doctor. Okay, go and get your eyes tested at Specsavers. These are some of the jobs in the primary healthcare. Then when we move into secondary and tertiary care, we're really talking about the jobs that take place in a hospital. So again, these are just some of the areas. So a doctor, a nurse, a specific area within the hospital that focuses on, for example, the heart or the lungs or the bones for a department consultant. We've also got, alongside of those, we've got allied health professionals. So we've got people who are psychologists, dietitians, counsellors, a whole range of jobs that support the secondary and tertiary healthcare providers. And then we've got the social care aspect of things. So we've got social workers, we've also got healthcare practitioners, we've got carers who go into homes or work in care homes. So these again are just some jobs that fall into the 4 categories that cover health and social care. Thank you very much for your time. If you've got any questions, please get in touch, and I hope to see you on the course come September. Thank you.